Welcome to The Explainer. Today, we're going to unpack obesity. We're going to get past all the headlines and really try to understand how it's defined scientifically, how it's measured, and why, those numbers don't always tell the whole story. So let's just dive right in with the most fundamental question. We hear the word obesity thrown around all the time, but what does it actually mean from a clinical, scientific point of view?
Here's how we're going to break it down. We'll start with a basic definition, then we'll look at how fat is shaped and measured in the body, and finally, we'll get into why all of this matters for our health. Simple as that. Okay, first up, what is obesity at its core? And as you can see here, it's about a lot more than just a number on a scale.
At its most basic level, obesity is about the abnormal growth of adipose tissue. That's just the technical term for fat. And this extra fat can build up in one of two really distinct ways.
Yeah, this is pretty interesting. On one hand, you have what's called hypertrophic obesity, where the fat cells you already have just get bigger. And on the other hand, there's hyperplastic obesity, where your body actually makes more fat cells. So the end result is more body fat, but how you get there can be different.
Okay, so it turns out that where your body decides to store all this extra fat is actually super important. This brings us to those common terms you've probably heard before, the apple shape and the pear shape.
So here are the two main patterns. We've got android obesity, which is that apple shape, more fat stored around the abdomen. This is more common in men, and this type is actually linked to a higher risk for things like heart disease and type 2 diabetes. That's because this fat, sometimes called visceral fat, is packed around your vital organs. Then you have genoid, or pear-shaped obesity, where fat is stored more on the hips and thighs. This is more common in women and, generally speaking, carries fewer metabolic risks.
So how in the world do we measure all of this on a huge scale? Well, that brings us to probably the most well-known metric out there, the body mass index, or BMI.
The reason BMI is so widely used is because it's just so simple. It's a really straightforward formula that just looks at your weight relative to your height. And this gives us a standardized score that researchers and doctors can use to look at health trends across millions of people.
And this table right here, this is basically the decoder ring for that BMI score. It shows you the internationally accepted categories, from underweight all the way up to class 3 obesity. You can see that normal weight range is defined as being between 18.5 and 24.9.
So let's talk about the key thresholds. The first big one is 25. Once the person's BMI score crosses that number, they're officially in the overweight category. For a lot of people, this is considered the point where health risks might start to creep up.
And the next major line in the sand is 30. A BMI of 30 or higher is the clinical definition of obesity. And as we saw in that chart, this category gets broken down even further into 3 different classes, with each one representing a higher level of health concern.
But, and this is a really big but, BMI has its flaws. I mean, think about it. It's just a ratio of height to weight. It has no idea how much of your weight is muscle versus how much is fat. So we need to look at other tools to get a better, more complete picture.
So if BMI isn't perfect, what else is in the toolkit? Well, quite a lot, actually. Things like waist circumference or the waist-to-hip ratio are great for measuring that risky abdominal fat we talked about. Other methods try to estimate your total body fat percentage. All of them give us a much clearer picture than BMI can on its own.
So let's just zoom in on one of these for a second, the skin fold thickness test. It uses these things called calipers to measure subcutaneous fat. That's the layer of fat that's right under your skin. And by taking measurements at a few key spots on the body, you can get a pretty direct estimate of a person's total body fat percentage.
Okay, so we've defined it, we've figured out how to measure it, but why does any of this actually matter? What are the things that contribute to obesity, and what can we do to prevent it?
The honest truth is, the causes are incredibly complex. There's no single reason. It's what we call a multifactorial condition, meaning it's influenced by this really intricate mix of our genetics, our lifestyle choices like diet and exercise, our socioeconomic status, and even our psychological well-being.
And because the causes are so complex, it means the prevention strategies have to be holistic. The cornerstones are pretty much what you'd expect: getting more physical activity, making sustainable changes to your diet. But it also includes things like practicing mindful weight control and, maybe most importantly, promoting better health education for everyone.
And all of this brings us to our last and I think most crucial question. We have tools like BMI that are really useful for looking at health trends across huge populations. But is a single number
ever truly enough to define something as complex as an individual's health? That's a big question, and it's definitely worth thinking about long after this explainer's over.